And may I ask you to briefly introduce yourself, and then we jump middle in the discussion.
Okay, then let me start. My name is Martine Jus. I'm in Switzerland, near Zurich, and I'm built up together with my late husband, Dr. Mohinder Singh Jus. I built up the SHI Homeopathic Center. It is a center with a college, with a practice with nine homeopaths, and also a pharmacy. It's a center all about Kantian homeopathy. And I'm practicing and teaching now since quite many years.
Quite 30 years, I think.
Yeah, around. And I'm very happy to be here because this is a subject which I find very important, and it's a very, very good that you've set up this, Maria.
Thank you. Who wants to continue? Jon?
Yes, hello, Jon Gamble from Australia. I have a practice in what's called the Southern Highlands, which is about 600 feet elevation above sea level. If you draw a line between Sydney and Canberra, it's roughly halfway along that line, just to give you an idea whereabouts I am. I've been in private practice for 31 years, I think. I've stopped counting after 30. And I work a lot in chronic fatigue syndrome. Particularly, I like to treat post-viral syndrome. So maybe I can offer something of value today. And what else about me? I'm author of 3, 4, 5 books on homeopathy. I'm just writing one at the moment, so that'll be number 5, which is all about my clinical experience. And apart from that, I just teach locally for the association here in Australia when they invite me, and when I'm invited by hosts such as yourself. So thank you for inviting me.
Thank you for being here. Who wants to go on?
Yes, let's Dr. Michael speak.
Michael, Rajeshwari meint, du solltest weitermachen.
Yes.
My name is Michael Frass. I'm working in Vienna, Austria. I'm a specialist for internal medicine and internal intensive care medicine. And I've worked for 40 years at the Medical University of Vienna. And one of my interests management of the difficult airway in emergencies. And also about since 44 years, I'm working with homeopathy. And I've just published a paper on additive homeopathy in lung cancer patients. And now my new interests are Trapper children. And I like to perform studies. And I'm also the first chairman of the German Scientific Society for Homeopathy. So I think it's necessary to present best quality homeopathy and to try to convince non-homeopathic doctors about the value of homeopathy. And of course, I'm not involved with, I was at least involved with lectures in India. And just 2 years ago, I spent some wonderful time and enjoyed Indian friendliness and hospitality. And I'm looking forward to cooperate with Ayush, and especially Dr. Manchanda. So I'm looking forward.
Thank you. Thank you for all the information. Rajeshwari?
Yes, I'm Dr. Rajeshwari Rapata, and I'm a homeopathic consultant practicing since last 23 years. I'm also into academics. I'm a professor in the Department of Anatomy, And I have been practicing. And this during this COVID, post-COVID era, this whatever topic today is there, post-COVID fatigue syndrome. I've been seeing cases for this, and in India, the cases are also on the reducing pattern now. But post-COVID patients are coming with these kinds of symptoms and newer kind of symptoms, new symptoms also, apart from fatigue, skin rashes, allergies, and fatigue. These kind of symptoms, especially skin symptoms, people are coming.
Yes.
So that is what we will be discussing today, and I think it will be a very interesting discussion.
Me too, especially as Jon joined us here today, who specialized on chronic fatigue syndrome after virus diseases. And Jon, may you just take over and talk a bit on your experiences?
Okay, so chronic fatigue syndrome is a really, really big subject because it, like all syndromes, it's not one entity. It's many different entities which coalesce or merge to form what we call chronic fatigue syndrome. And if you have pre-existing disease of some kind, or you have susceptibility to certain influences or diseases, then whatever the affectations or the infections or the noxious substances that have brought about your chronic fatigue syndrome, it's going to be different for every person based on what you already have with your health. But in terms of post-viral syndrome, unlike other types of chronic fatigue syndrome, what I've found is that the treatment is pretty much standardized for most people, provided you know what the original virus was. And so my approach has always been to choose a nosode, whether it's the exact nosode or a very similar nosode, to do with the original virus, and to give the nosode in addition to the homeopathic remedy based on the presenting symptoms. So for example, we have a patient, for example, who might have been never well since having had glandular fever, infectious mononucleosis, what they call the kissing disease. And they had perfectly good health up until that time. And they had a severe case and were in bed for many weeks, but they have ongoing symptoms ever since that virus. They might be cognitive symptoms, such as foggy head or headaches. They might have neurological symptoms, such as pins and needles in their limbs. They might have respiratory symptoms. In all these cases, we would always use a nosode developed. Give them the nosode. The nosode we have here in Australia, we have put 4 things into to make a complex nosode. And we find it covers about 95% of cases of people who have post-viral syndromes. And we start with 30C, we go up to 200C and then 1M, usually about 6 doses of each potency. The patient gets a small aggravation at the beginning. It's always the same symptoms that they had when they had the initial infection return briefly with the aggravation. And we find this clears the virus very quickly in all cases, up until now, up until COVID. So I hope to say maybe this experience is going to be beneficial for people in other countries who are now having to treat post-COVID syndrome. Here in Australia, we don't have many cases of COVID at all, really. We've been very lucky because we're an island nation. Australia has had a comparatively small number of COVID cases. So we haven't yet seen cases of post-COVID syndrome yet in Australia. So I hope to learn from my colleagues overseas what they're doing.
And Jon, do you give the nosode of COVID at the moment? Is it allowed in your country?
We have the nosodes for COVID. Yes, we got them. There are several different nosodes, and as far as I know, we have 3 from different sources. So we just combine them all together.
Okay.
I think it's similar enough, even if you haven't got the exact strain of the COVID. It's similar enough to be efficacious.
Probably. So this sounds very interesting, because here in Europe, we obviously have already the post-COVID chronic fatigue syndrome. We entered in that. So it's a not good situation that now that people are starting with the fatigue syndrome, they're beginning the vaccination the same time. Because if some people who suffer from the post-COVID syndrome get vaccinated, that won't be a good outcome.
You're not going to know whether the chronic fatigue pattern is arising from the actual infection itself, or whether it's a consequence of the vaccination. That's the problem.
Yeah. So Martine, how is the situation in Switzerland? What are you seeing?
Yeah, we have two, I have 2 things to say. When we have patients that we treated with 3 types of cases. The cases that we treated, we didn't treat them for COVID, but they were our patients before. And they developed some symptoms, mostly some kind of fears, or mostly sometimes of still respiratory symptoms, or of fatigue. These are the 3 symptoms we are seeing the most often. And this is one. And they are not, let's say, very difficult to tackle, I find. Because basically, I guess, because they got a constitutional treatment for some other problems, that mostly it is something that we can tackle with, very often we have Sorinum, Natrium arsenicosum, or based on the symptoms that they are having. So we are not using the nosode in our center. We have no experience about that. And the second types are the one who got COVID and were treated from us through the infection. And these one don't get post-COVID till now. What I can say, we are now analyzing all the patients we've had, but we don't have, because it seems to be different. But I have to say that these patients that we were treating were not the patient who went to the hospital. They were the patient who had COVID and were at home. So we didn't get the very severe cases. This is very important also to remember when we think about it. No? And the third cases are the one who come in the post-COVID syndrome, but didn't come to any homeopath before. And this we can also help them, but it goes slower. This is what I've seen. But I think that in all the cases we can really help. Our approach is to make, in any case, a prescription based to the totality of the symptoms. What I've seen in patients who had to go to the hospital, they are very often still weeks and months after in a shock. The shock of the hospital, the shock of the fear of that is still very much there. So they have this anxiety disorder, sleep problems, and all this. And this is something we can tackle very well. And also the respiratory problem, the remaining problem with little bit dyspnea or this impaired lung function can be also tackled with homeopathy. This is actually the one field where, if you see all the problems of long COVID, this is one field where homeopathy has so much to offer. No, we have so much to offer, and we have the experience. As Jon said, we are treating since so long viral chronic fatigue or post-viral whatever syndrome comes, because it is what you said, Jon, depending on the miasmatic background of the people before, depending what they are carrying in them, virus can stimulate any problem, basically. No, you can have, like you said, Rajeshwari, skin rashes, and you can have the deepest of the depression, depending what you had. But I hope also that we can set up all together the homeopathic community, really very good studies to see all this. It is a tricky situation because you have the cases who were treated with allopathy, the cases who were treated homeopathically. Where is the more danger? This is a very interesting field. But mostly our patients, they are out of their problems in, I can say, it depends. Sometimes it's incredible, you know, sometimes you give them the proper, the medicine, and 1 week later you check them up and they are 90% better. And after 2 weeks, they say, now I'm feeling absolutely okay. But what I hope is that we are able, by saying to the people that homeopathy is a very, very efficient possibility and therapy to treat this post-COVID syndrome, I hope that we get more of them because allopathy doesn't have much to offer in such cases. It goes from one problem to the other, no? They end up with a sack of medicine against the depression, against the sleep problem, against this, against that. And this can't be the solution. They're just getting sicker and sicker. So this is my appeal to anybody who knows somebody with post-COVID syndrome. Just offer them that homeopathy can do something.
Just offer the possibility.
Yeah.
And the idea.
Sure.
Our professors, what do you want to add?
Yes, during the when I was seeing the cases, different cases, post-COVID cases, I found that most of them are having lots of skin complaints, coming with newer kinds of allergies. Means a 20-year-old person who was never having any kind of allergy developed a new allergy. Okay, skin complaints like rashes or urticaria, you can say. This kind of symptoms are there. Some people, sleeplessness, insomnia, okay, and lots of fatigue and weakness and prostration. And I found that some of the cases, almost 80% of cases, you will find that they are affected only psychosomatically. So it's kind of psychosomatic illness. And rest of the 20% with pre-existing diseases, there can be a flare-up of the pre-existing disease. And along with that, there will be a chronic fatigue. And if the underlying disease is covered up by the homeopathic medicines, the fatigue will also go away. So even those symptoms which were along with the fever and all, the loss of taste, that also persisted for a long time. Even after the fever subsided, these symptoms also remain for a long time. So I found that sarcolactic acid I had given to many patients who had this kind of prostration and exhaustion and complete fatigue. And it has a very good effect. I found that sarcolactic acid. Along with that, I also gave Califos, Gelsemium, Conium, Ignatia. In one case, I gave Onosmodium also. So the person was having a severe headache, you know, the symptoms of Onosmodium. So Onosmodium also worked very well. So in this way, these medicines give a very good results in case of the chronic fatigue after COVID.
It's interesting that you mentioned Conium and Ignatia.
Yeah.
Which, yes, they are pointing to a different direction. Would you like to tell more about those cases? I'm very interested.
Yes, Conium case was one patient particularly She was around 70 years old and she was craving like anything to go for shopping in a mall. That is one symptom I caught. And then she was having extreme amounts of fatigue and she already had suffered from corona. Starting phase when the corona started. It's around March, April. And since then, she was having a lot of fatigue. And along with that, she also developed a vertigo. And whenever she went to bed, she felt like she was sinking into the bed. That vertigo was that kind of vertigo. And while lying on the bed, she was getting vertigo. But after waking up and after getting up, walking, she was feeling fine.
Okay.
And she was having an irresistible desire to go for shopping. I said, go for shopping, no problem. And once she went shopping and came back, and then I also gave her Ponium. A few days later, she was feeling absolutely well. And then she thanked me. She said, now I'm feeling very well. That vertigo is gone. I don't feel any vertigo now, no more. And her exhaustion also was gone.
And the tendency for going to shop?
Yeah, she fulfilled her desire.
Very, very interesting. And the Ignatia client?
Ignatia, she had a death in her family actually. Okay. Because of corona, and she was also quarantined because she was also affected. And after that, she started having a maze of symptoms, and mostly were psychosomatic. She had no pre-existing disease, and all the conditions mentally, the grief was there. And then after that, she had no desire to do anything, no work at all, and sleepiness was there, and no inclination to speak to anybody. And she was always crying and weeping and all that. Symptoms were there. So I gave her Ignatia. And after a 15 days period, slowly she recovered and she's feeling better now. She's talking with everybody and mixing up with family members, calling everybody. And now she's fine.
But from what I understand, Rajeshwari, you are prescribing on the individual symptoms, no? You don't have a standard method. You prescribe on the individual symptoms.
Yes,
no?
Yes.
Because the case you are saying were clear Ignatia, conium, or whatever.
Yes. Yeah. Yes. Yeah. Sometimes when a complicated symptoms come, at that time, I take help of repertory and I do the repertorization and find out. And also I see the miasm, and according to the miasmatic remedy, I give the miasmatic remedy, then I follow up with the acute remedy. So that things also I do. But most of the times I follow with the individual symptoms, I catch the peculiar symptoms and I give the medicine.
Yeah. Okay. What I've seen, because we had quite a few cases of phosphorus came quite often. And in the first phase, this depends where you get them. Do you get them 6 months after they had, they are already since 6 months in post-COVID syndrome, or you get them straight in the beginning? It seems to depend also a little bit of the approach. Yes. And we got in the first phase, we have really quite a few of this natrium arsenicosum. We have quite a few of them. This is really an absolutely great medicine when the exhaustion is in natrium arsenicosum is terrible. During the COVID or in the post-COVID, this is one of the most terrible exhaustion that you have. But you don't have the fears of arsenicum. You don't have them so much, and you don't have the restlessness of arsenicum, no? And you don't have also this complete dejection of everything as this worsening of music of acidum phosphoricum. And this is a very interesting medicine because it covers, interestingly, we made a proving of NAT-ARS many years ago, and it came out really that many of the symptoms of the acute COVID and post-COVID are covered by natrium arsenicosum. I don't want to say it's a specific, no way. We never give in our clinic anything specific. We always see the case because you spoke about Ignatia. We had also a few cases of Ignatia when the patient gets I mean, everything is checked. There is nothing in the lungs. It is really on the psoric level. And then they have this panic attack at night. It's very typical for Ignatia. They get this panic attack at night. They wake up like this. It can be lacasis. It can be another medicine. But this Ignatia, when they have contradictory symptoms, it's very a sure shot. I agree with it. But I would say check into this Natrium arsenicosum. We have the proving on our website, on the shi.ch. There is, then you have to go to the Bose Stiftung. This is our trust, and we have it also in English. So and we have also quite many cases of psorinum, because psorinum is, in our experience, a very important medicine in the post-viral problem. And I wonder if somebody had cases of carcinosin, because carcinosin, in our experience, is a very good medicine in post-mononucleosis problems. This is one of the, I think, John, you must confirm that it's a medicine which comes quite often. No? I had tremendous effect of people completely exhausted after mononucleosis, completely, young people, and I gave them carcinosin, and after 2 days they were okay. So this is sometimes fantastic. And this we still didn't have any case of carcinosin post-COVID, something to keep in the head.
Yes.
Because of the miasmatic aspect of carcinosin, no? Having a lot of tubercular, a strong tubercular part of it, and COVID having this, it's kind of a paralytic weakness, what the patient had, no? And this paralytic weakness is tubercular. You can feel them with some, I don't know, good food and vitamins. It doesn't help. It's much deeper than this, no?
I also covered some cases with sarcolacticum acid, where the patients had already pre-existing cardiac complaints. And specifically, it is mentioned in Boric that after viral illness, or it's after epidemic influenza, sarcolactic acid is indicated, especially when the person is with metabolic acidosis, with already cardiac complaints, dyspnea, muscular weakness, because it's a tendency that whenever a person has that muscular fatigue, the sarcolactic acid, it collects into the tissues. And this is a very effective medicine. It many times prevents the hospitalization of the patient. The patient is in such a condition that he feels that he needs to be hospitalized because of this kind of muscular weakness and fatigue. There is complete neurasthenia. So at this condition, during this condition, the patient will thank you if you give the sarcolacticum acidum after the illness, after the viral illness, any kind of viral illness. So that I have found very much effective. Almost many patients I had given this.
Very interesting. And also the complaints of the acidity in the body, definitely. Michael, what do you want to add in?
I think chronic fatigue syndrome is one of the more difficult situations for homeopaths, because, as you know, it may be either bacterium, virus, or parasite, or it might be because of a physical or psychological trauma, or by intoxication. Now, with respect to COVID, interestingly, I don't know why, I have only treated 2 persons so far, and both of them didn't have any problem with chronic fatigue. And I have a little bit more experience with cancer patients. And one of the remedies helpful in patients undergoing radiation therapy is cadmium sulfuricum. Of course, sometimes those patients might also need radium bromatum. And some of the cancer patients, I'm successful with China or Kininum arsenicosum or Carbo vegetabilis, but I think, and also of course phosphorus, but of course I believe the most important thing is, as already mentioned, careful repertorization and individualization of homeopathy. But also in some cases, it might just be impossible to help a patient with chronic fatigue. And this is, of course, obviously a somewhat difficult situation. So I think we should put together all our experience and all our case reports so we get a little bit more chance. I've never used sarcoleptic acid, for example, so I've just learned something new. And I'm just looking forward to all other ideas we might get today. But still, I think individualization is the most prominent means to support patients with homeopathy.
When I listen to the remedies you mentioned, they are all remedies that have in common that the metabolism of the cells is coming to an end. Metabolism is already getting very slow on the cellular level. This is very interesting to me. Jon, what is your experience with that?
Do you mean with the sarcolactic acid, you mean?
Sarcolactic acid and the chronic fatigue syndrome, is it linked to slowing down and breaking down of the metabolism of the cells?
There are three root causes in chronic fatigue syndrome. The first one is what we're talking about tonight, infection. In this case, it's a viral infection. Mm-hmm. But you can also have bacterial infection. For example, patients with Lyme disease have a spirochete infection, which is bacterial infection. You can also have a mycotoxic infection. So that's mold spores making you sick. So the first thing is infection. The second thing is toxicity. Toxicity means iatrogenic toxicity, so maybe side effects from medications that you have taken, not just are taking, but have taken. So the oral contraceptive pill, for example, even though you may have taken it 30 years ago, it can still be affecting you, I've found. Or other kinds of toxicity might be poisons. People who use a lot of chemical sprays, for example, particularly farmers. Even poisons in the home, cleaners, plasticizers, things like that. So toxicity. The third factor with chronic fatigue is deficiency. Deficiency. And here we find a lot of people with chronic fatigue syndrome are extremely deficient in their zinc and in their vitamin B6. So you might have all these factors coming together to create the syndrome of chronic fatigue syndrome. And one component in that patient may be a post-viral syndrome, but they might have several of these other things happening all at once. And if they do, then these are the very complex cases of chronic fatigue syndrome that require more than one line of treatment to bring to cure.
Understandable.
In relation to my experience with sarcolactic acid, I haven't used it in treating a post-viral syndrome, but I've certainly used it in treating fibromyalgia. And I found it a very good remedy for fibromyalgia. So muscle pain and muscle weakness and fatigue, yeah.
Very interesting. Very interesting.
I have a question to you, Jon. You said before, if I understood well, you said that your approach is to give the nosodes, and that you and then you said first, let's say, and then you said that you have a nosode in Australia with 4 virus, also made from 4 different viruses. Did I get you right?
Correct.
Can you tell us what it is? Also, which viruses are?
Yes, yes. So it's got cytomegalovirus. It's got influenzae. It's got Coxsackie virus. And it's got the Epstein-Barr virus mixed together. We found probably 80% roughly of people with never well since mononucleosis. The nosode of cytomegalovirus is the best nosode to give them. They respond much more quickly. But then there's the other 20% of people who didn't respond to cytomegalovirus. The other 20% responded to one of those other nosodes I mentioned. And that's why we put them all together, not just for our own benefit, but here in Australia, because I teach other and mentor other practitioners, we can then say, well, use this mixture of nosodes as your antiviral, your post-viral treatment. And we get them to give this mix once every second day. And on the alternate day, we give the therapeutic remedy of choice on the basis of totality of symptoms. So that might be gelsemium, or it might be phosphorus, usually one of the polycrests. So we do this alternate treatment. One day the nosode, the next day the remedy of choice based on presenting symptoms. And we find this has been the most rapid path to bringing the patient back to cure quickly. Often it's just in the matter of a few weeks and they're back to cure, to normal again.
Which is a miracle for a chronic fatigue patient.
If it's the only factor, as I said. If they were perfectly well before they had the virus, no other illnesses, no other idiosyncrasies, so the virus is the only factor which has affected their health, then the treatment is effective. But if they already had something going on before getting sick with the virus, then you still have to treat what the something else was as well. So it becomes more complex.
We have one comment here from an Italian colleague who wants to know more about carcinosinum in treatment of COVID.
Maybe I was not clear enough. I don't have any experience with carcinosin in treatment of COVID. My thought, my idea was just that because carcinosin is quite common and efficient nosode after mononucleosis, that we should think about it. And because the mathematic aspect of carcinosin matches also with a lot of symptoms we are having, that it can be a possibility. But I don't have any experience with that. Maybe somebody else of you have, but I don't. Not with COVID.
I think I also have no experience with carcinosin chronic fatigue syndrome. I think the main problem with carcinosinum is that the preparation may be different from pharmacist to pharmacy. And this is a major problem because sometimes you might have cells from prostate cancer, sometimes from breast cancer. And as you know, breast cancer is much differentiated during the last few years. So breast cancer doesn't say anything exactly from a conventional medical view. So I would say we should be very cautious exactly with this nosode, as long as we don't have different nosodes with a defined origin and a defined source. So we can really rely which type. I think it's like we have so many different tuberculins. We cannot just say it's one tuberculin. There are so many on the market, and this should be kept in mind whenever we use catinisone.
Yeah, thank you for that comment. It's important. Rajeshwari, did you see anything?
After sarcolacticum acidum, califos is one common one which I usually give as a biochemic medicine, not homeopathic. So it definitely helps in the post-COVID syndrome, fatigue syndrome, califos. And another remedy, commonly arsenic can be given. And when arsenic failed, at that time I gave many times sarcolactic acid, as it is indicated in our homeopathic materia medica also, that you can give sarcolactic acid after arsenic fails, and it works well. Then you have phosphoric acid, the extreme exhaustion of phosphoric acid when you find people with diabetics, usually those who are diabetics. And there you find this complete exhaustion and the prostration extremely. Phosphoric acid is one which also helps very well. And depending, I didn't use any carcinosin or tuberculinum. All these nosodes I have not used specifically, and I have given only the simple medicines, and it worked well for these things. Only 1 or 2 people were hospitalized. Otherwise, many of them felt very much better by these medicines itself. But recently, I found some research articles, especially from the overseas people from Australia. And those articles, they said that something new called as post-COVID dose. I didn't get any patients, but I heard about that. Post-COVID dose. It looks like some kind of chilblains or frost bites. And these kind of patients are more.
Interesting.
Yeah. So that is one thing which is more peculiar, so what kind of medicines could be given for those complaints, post-COVID dose? That we can discuss.
What is the pathology that you're talking about? When you say this, what is the actual pathology that takes place?
Pathology is unexplained, actually. There is no kind of pathology, but these people came with some kind of red or purple bumps on the toes, on the fingers and on the toes. And these are painful also. Sometimes they may be itchy also. Itching was there. And some other peculiar symptoms these people exhibited was some kind of heaviness in the chest. These people said that elephant sitting on the chest. So I found that this is something peculiar. Now, what kind of medicines they can give for this kind of symptoms?
So the skin you're talking about is not necrotic tissue. It's like a vasculitis. Is that what you're saying?
Yes, it's somewhat like inflammatory, you can say, reddish or purplish color, and painful and sometimes itchy. And they also had complaints of elephant sitting on the chest. And they have named it as COVID toes.
Interesting, very interesting. The symptom, elephant sitting on the chest. In our countries, we probably wouldn't say an elephant sitting on the chest. It's a millstone sitting on the chest, probably. It's interesting. In India, you're thinking of an elephant sitting on the chest. Very interesting.
These studies are from other countries, from Australia, UK. Australia and UK. I had seen these research studies as I was exploring for these various kinds of symptoms. What kind of symptoms other people are getting? Means I didn't get this kind of patient, but when I was exploring, I saw this. So I thought I never got, and even in India, I didn't think. As I have conversations with my colleagues, I don't think that this kind of people have come to us with COVID toes and all this. But I have got some patients with skin rashes. Yeah. So it was interesting.
Interesting, really. We have somebody asking, sarcotic acid following arsenicum well? Rajeshwari, could you please tell again when using sarcolytic acid and when arsenicum?
No, it is said in the Materia Medica that if arsenic fails, you can give sarcolactic acid and it will definitely act well. In post-influenzal weakness, exhaustion. That is, you can say post-COVID is also post-influenzal in some sense, isn't it? Mm-hmm. So post-viral, post-influenzal, you can give. Mostly we give arsenic, but what happens depending on all the symptoms, collective symptoms. But if it fails, then we can also consider sarcolactic acid.
Okay, and the other thing is that somebody mentioned that she uses the Tino Smith's version of carcinosin because it has many vibrations in it.
Yeah.
So just then something I think worth mentioning.
Just a comment on the earlier comment about carcinosin. I do think that the original carcinosin we got from Dr. Furbister back in the 1950s, I do think there's something wrong with that. When I say wrong, whether it's been adulterated or somehow affected in some way, because I find I don't have success with that particular version of the carcinosin. So we in our clinic also use Dr. Tina Smith's 15T version, and we find that's better, more effective.
There is another, we have quite a few cases also of psorinum. I would like just to, because psorinum is one of a very common medicine in post-influenza, so in problems after influenza. This is quite a common. It has done exhaustion, and this is one of the situation where the patient just want to lie down, and normally psorinum we know is better after eating, no? Has a big appetite, is better after eating. But in these cases of post-influenza, or now also the cases we saw of post-COVID, not always there is appetite, or very often there is a very reduced appetite. But whenever they eat, sometimes they have to eat. Whenever they eat, they feel a little bit push. So this is a symptom, and they get very chilly. They are weeks and weeks after this COVID, they are still very chilly. And there is the mental situation. Psorinum has a lot of fear of future, fear of economical situation, fear of how it's going to be with the job, no fear of losing his life, and so fear of diseases. There are big hypochondrism is a central aspect of psorinum, and also fear of future, fear of disease, fear of losing job. So if you have this situation with a lot of exhaustion, in our experience, we give in such cases, we give C200 mostly, or we start with C200 mostly. And depending of the case, we might give we give mostly 1 day, or we may give one dose for 3 days, and then we observe. There is a difference in the posology in our experience. If you give like an azote, depending what you give. If you give acidum phosphoricum needs a little bit of repetition. Let's say like this, if you give one double dose or whatever, it will not work so good. You have to repeat. So in such cases, we use quite often Q potency. It depends. You have to have the knowledge of the patient, of the situation of the patient, the knowledge of the medicine also. And then you can make the posology. But many medicines, or if you give, I think, Michael, you talked about acidum picricum. This is also a medicine who needs, or if you give ferrum picricum, quina ars, these are oft medicines which need a little bit of repetition. But if you give a calcium carbonicum, which we didn't have cases of calcium carbonicum in post-COVID, but or you give sorinum or like this, mostly these are medicines which don't need much, if at all, much repetition. So this is also an aspect that we have as homeopath, we have to be conscious about. And I have a question to Jon. You give alternate, this I got, and how long you give it?
Sorry, what was your question?
How long? You explained us, you give your alternate, nosodes, and the individual medicine. This I understood. And you start with C30, I think?
Hmm.
And how do you go further, and how long you give this in alternate?
We get them to dilute the first dose of their 30C to reduce the aggravation. And you're always going to get some kind of, I don't really call it aggravation because that word puts the patient off, but I just say to them, you'll get a revisiting of your initial symptoms. So they understand that. So we get them to dilute the first dose in a glass of water. And then if they're happy with the aggravation, it's not so bad, then they go to a full strength dose next. And depending on how long they've been sick for, so for someone who's been unwell for maybe 10 years, for example, I would give them 10 doses of the 30C, and then they go on to the 200C. Most cases, we don't need to go higher than 200C, but if we still have viral symptoms when they come back for their next visit after taking the 200C, then we go up to the 1000, the 1M. So that's 10 doses of 30C, 10 doses of 200C on alternate days in consecutive order. If the patient has only been unwell for 1 month and they still haven't recovered, then I wouldn't give 10 doses. I would only give perhaps 3 doses of the 30C, 3 doses of 200C, and that would be it. That's all they need. So it depends on how long they've been sick for.
Jon, there's another question for you. Somebody would like to know whether it is possible that a person having cytomegalovirus antibodies could have infected with mononucleosis in the past.
I don't always trust the pathology testing systems, I have to say. Sometimes you get false positives, for example, or you get negatives, which are not correct. So I'm far more interested in the symptoms than what the pathology test says. Because I've had cases where they've had all the symptoms of glandular fever, but the test results don't show us anything. So I ignore the test results. I'm far more interested in the initial symptoms the patient experiences and the subsequent post-viral syndrome, and I prescribe on that. So, but I do think, because of the similarity of the viruses, I do think there's to answer the question, there is yes, a high similarity between the vibration of cytomegalovirus and the vibration of the Epstein-Barr virus, which is presumably the virus which causes mononucleosis. Yeah, it's very similar.
At least with mononucleosis, I had quite good results using the Lycopodium clavatum.
Interesting, one of the ancient ones. Martine, I just thought of pseurinum, and we all know pseurinum is made of scabies. And the only animals who get scabies are the ones with malnutrition. the ones who are not cared for, the ones who live under bad circumstances and don't see the light. So this is interesting too.
Yeah, I think, you know, Soranum is a great booster for also for the immune system, no? So we know that, I don't know who of you, somebody said this, I think it is very important to consider the situation before the disease, in which state was the patient and before it started, because something made his life force, at the first time, made his life force so weak that at all he could get sick. This is, no, there is something prior to the virus. There's always something prior to the virus. And this is important to understand the dynamic of the disease. If somebody is in a very emotionally difficult situation, let's say he is in a divorce case or whatever, and then he gets COVID, he would be prone to make complications and to make problems after that if somebody doesn't have this. So this is, and Psorinum is very good for people who are basically, how do you say, anxious type of people. Basically anxious type. They have a lot of problem with fear of death, with fear of losing things. And they are, my husband would say would always say they are chicken in their hearts, you know, they are not strong people. So yes, I mean, we see it also in veterinary, no? Homeopathy. When you see a Psorinum cat or dog, may he have problem with whatever, with skin or so, they are really looking like, oh, you feel, oh, poor dog.
Yes.
No, you feel, oh, poor. And this is the same feeling you get with humans. They are not fighters. They are not the fighters.
Animals. No, they're the other ones. You're absolutely right.
That's it. But you know, it is very important, and I think the experience of Jon is very interesting. But otherwise, it's very important to really take the big picture. Like Michael, you said, to individualize the case, to take the big picture, to see the mathematic aspect, to see the exciting cause of the whole problem, to see in which situation now the patient is, and then to give the individual medicine. I don't think that we should go too much for a fully standardized approach, which of course many of our colleagues would love to have. But like this, life is more complicated than this, no? And Jon, you said also, no, you give the nosodes, but you give the individual medicine also. Just to give the nosodes will probably, I guess you tried this also, but just to give the nosode is not enough, no?
I find most cases will respond better if you prescribe the remedy that they need as well. But in many cases, the remedy they need is not enough.
Yeah.
So the nosode goes straight to the exciting cause, if you like, and erases the exciting cause. Yeah.
So thank you for sharing this very interesting information. Unfortunately, I don't think we have the nosode, the combi nosode, or this nosode made from 4 sources in Europe. I don't know about it. Maybe somebody knows about it, but I never heard of it.
We can post some to you. We can post some to you if you'd like some.
Very good.
Yes, this is always the good thing here, that we can share information and we can share products, and we can learn from each other. It's very different approaches, and the more we learn from each other, the better we are.
I have a question to Michael. Any knowledge of any good research, homeopathic research going on post-COVID?
we have done a colleague of mine. He has treated 13 patients in a rural hospital in Austria, and 12 of them have survived. A single patient who has died. He was in a very bad condition arriving at the hospital. About half of these 12 surviving patients have been on the intensive care unit, and they survived in a very good condition. The only study going on in the moment I'm aware of is with Menachem Oberbaum in Tel Aviv. And I think he has started already last year, long before vaccination was an issue. So this is, to my knowledge, the only study with COVID and homeopathy. And of course, with Glyphicol, we are collecting cases. And of course, you are invited to submit your case reports to Glyphicol. And otherwise, I'm not aware of really sound research with COVID. And, I think the main problem seems to be opposite to previous epidemics. There's no venous epidemicus, which might be used for all patients. I think one of the remedies which seem to be very promising is Lobelia purpurascens, which has been found by my teacher, Dr. Resch, Lobelia purpurascens, not purpurea, but purpurascens. And this seems to help in many cases. And the second remedy, I think, which has been found by Jens Wurster, seems to be Bryonia alba. And of course, calcium, phosphor, and so on. But I've put together about 10 different remedies which are in my pocket. So in case I have to be transferred to the hospital, you never know. It's good to have your remedies with you, because in the moment it's very difficult to transfer remedies into a hospital. And it might happen to me too, of course. So I would say we could maybe put together a kit. Comprising about 10, maybe 15 different remedies, so at least you have a relatively good chance to survive. What I think with respect to the negative problems following COVID may be due to thrombotic or embolic situations in the lungs. So, you know, my private first-class remedy is Lachesis muta. I still believe it might be also helpful in these cases. Of course, Crotalus, Floridus, or Cascarilla might be a chance, but it's surprising because some of the young patients are complaining about lung problems, and I could imagine that Lachesis might help, but so far no one has found the way to my office, so I cannot say it for sure. You know, otherwise, I think in India there was at least a study, a prophylactic study with Syndrom, so maybe Dr. Rapata knows more about it. And I think they have given it to some 100,000 people. So
didn't get you.
He's speaking about, you know, the study that you made in India, or with Arsenicum album as a preventive.
Yeah.
In India. This was given to many people. Hmm?
Yes, it was given. Right. And after that, also there was a study which mentioned that arsenic, phosphorus, and tuberculinum have to be given in alternatives, like should be followed up.
As a preventive?
Yes, as a preventive. APT, arsenic, phosphorus, and tuberculinum, AVR.
what we saw in the acute, or what we still see, we have less and less cases. This is good. The cases are going down in Switzerland, so we're very happy about this. But what we see still, our main medicine remains bryonia. And Michael, you talked about Jens Wurster. He's also in Switzerland. Maybe, I don't know, this is our genus epidemicus. And what I was thinking, but we have other remedies and we make a kit. This is interesting. We make also a kit. We have a 10 remedies kit that we give to the patients. Or when, for example, somebody calls us and say, oh, the father had to go to the hospital, and say, okay, come first, you get the kit, and then you go to him, because it's important. Otherwise, you lose time. No, and these are not all are common medicine. Not all cases are bryonia, gelsemium, and kits which are in the normal, let's say, in the normal house kits.
No, these kits obviously help. I have seen, because many times we give the in a busy practice sometimes, and sometimes when lack of medicines. Now in India also we are facing, when we need the required medicine, we don't get it at time. At that time, we give that medicine which is available. Most frequently, when bryonia is available, we give bryonia, and it suits well. And then patient never comes back, and he is happy and thanks us that he is well. So this happens. So these specific kits which you give is also very helpful. That's why when I decided this course, I designed this kit for the emergency first aid. So I give this list of medicines which are very much useful to sustain that condition temporarily till the advanced help is available. So the patient is saved by those medicines till then.
And something I was thinking before, when Michael, you talked about lachesis and your experience, that it was your favorite medicine, some lung embolism. And I was just thinking, it could be, I have no idea because I had no cases, but it could be a medicine for this COVID toes, you said, COVID toes, no? Because what did you say? You said it's blue-red, which is, itching, and this elephant sitting on the chest.
Yes.
So keep in mind, I don't know.
There are two conditions. One is COVID toes, and similar type of condition is called as the pernio. And the difference is this COVID toes happens in the toes of the leg, and pernio happens in the fingers. And this condition is same. There are some kinds of bumps on the fingers, and those are red and purplish. That is pernio. And COVID toes are found on the feet, Okay. So that is the difference. Both look same, but it is on the toes, and here it's in pernio, it's in the fingers. But what we found here post-COVID is post-COVID toes, not pernio.
Okay.
So that is very peculiar, So this is the condition which they have found.
I wonder. It would be very interesting to know, but then you think of Cabo animalis, lachesis, arsenicum, and others, no?
Yes. Lachesis seems to be suitable because of that, but you have to see the whole case. But again, elephant sitting on the chest is that kind of heaviness in the chest.
Mm-hmm.
Again,
this would be, the lachesis. Somebody is sitting, they don't say elephant, somebody is sitting on my chest, no?
Yes. And at the same time, the patient has that kind of constrictive feeling where he is not able to sustain any kind of tight dress or something, then lachesis will definitely suit that person. When there is a constrictive feeling and unable to hold any kind of tight feeling, tight dress or collar around the neck, around the chest, then lachesis will be absolutely suitable.
I was just wanted to say something also about research. I think it's very important, that we step. It was very difficult for the homeopathic community to step in the treatment of acute COVID, because obviously we were not welcome in most of the situations, no? Or the one of us who were welcome were very few. Let's say this way. But I think the situation in the post-COVID is completely different, because these are the cases where allopathy doesn't have much to do. So what we are doing in Switzerland, we are thinking, maybe Michael, we can talk a little bit after online about this, if you have 5 minutes, because I think we should really try to set up something for the post-COVID syndrome, you know, to try to really consolidate all our experience, and then make this available to the community. This is very important. Or maybe I try to think together with my team. We try to think of research. How do you say, model? But the problem is always the same. No, we don't have. I mean, when you make a research model, you need to have a kind of you have to compare it to something. And in order to compare it to the one who don't get homeopathy, you need to have enough. You need to have access to this, and because the cooperation, at least I speak for myself, the cooperation on this level is quite difficult in Switzerland. So, but we don't give up.
No, and then again, it's the question of time.
Yeah.
People will need help now, not in 1 or 2 years.
This is the problem, yes.
When we have the positive results that homeopathy can do something.
But that's why it's very important, and everybody of us really collects and documents the cases they have of post-COVID very carefully, very carefully. This is very important, because we tend sometimes when, when the case is very clear, we tend not to maybe document it as carefully. It could be.
Yeah. One question I still have is, did somebody see sarcoidosis as post-COVID syndrome? Sarcoidosis in lungs, nothing. Or at least not yet. So there's something still to look for. Any other kind of autoimmune reactions you did see? Maybe the frost fingers is some kind of autoimmune vasculitis, could be.
I mean, look, COVID has a lot of, the tubercular aspects of COVID are a lot, and most of the autoimmune disease have a strong tubercular part. So I think this will come.
It's still too early to discuss.
But we need more quantity. We need the patients who were not into homeopathy till now and who are suffering of post-COVID. This would be, I hope that, that the word spreads and that they come more and more. Because then these cases will come. Otherwise, they'll end up in allopathy.
Yeah. So this is still a call to our colleagues to send in cases or to give video testimonials, which we can collect, so that we more and more can document.
Sure.
Anything you want to add in here? Or should we go to our last comments? Anybody have any questions left? No? Looking at the screen, no questions coming on. What was quite a thing today was the sarcolactic acid. People got first time aware of it. So thank you very much for that information.
Actually, post-COVID syndrome, it's a long way to go. In the coming days, we'll find more and more peculiar symptoms, because it's already post-COVID syndrome itself is a collective symptoms which are mysteriously appearing after people who have survived the corona. So still in the coming days, we'll be finding many patients with coming new symptoms. And we are looking forward with good homeopathic medicines, which will be helping them. So that will be in the future. I think we'll have to do one such webinar in the future after at least 2 to 3 months after this, so that we will get new cases too and we can discuss on that.
Yes, we will definitely do again. And Martine, I would ask you, as you have a pharmacy, that you start making a COVID kit, which we can recommend.
Look, yeah, I can make a house kit. I cannot make a COVID kit because this kit because this is forbidden by law. But I can make a house kit, which is yeah, absolutely.
Kit for viral
infection. For such whatever. Yeah. Find a fantasy name.
Kind of fantasy name.
Coco kit or whatever. It doesn't matter. But this is you are not allowed to put any indication on it. No.
I understand. But if we would have such a kit available in a pharmacy, which people just can order in case something is getting a bit troublesome, that would be a help.
Yeah, we can talk after with Michael and see which medicines you give and which medicine we give, and then consolidate this. This is a good idea.
And maybe, Jon, you can give Martine access to the nosodes you have in Australia.
I'm happy to send the nosodes, yes. And I was also going to say, we have a flu kit. So we've told all our patients that they should have the flu kit in their home in case they need to use it for COVID, because when COVID came a year ago, we thought people aren't going to know whether they've just got seasonal influenza or COVID necessarily, unless they get tested. Because a year ago, there were no tests available. So we said to everybody, make sure you have the flu kit in your home. So I can tell you the remedies we have in the flu kit.
Very good.
We have arsenicum, we have bryonia, we have phosphorus, eupatorium, gelsemium. And all of those are in 200C. And we have chelidonium 6X. The reason why we have chelidonium 6X is because it's used for the fibrosis or the consolidation of the lungs that you get in pneumonia. It seemed to us that people were getting this unusual pneumonia with COVID. So those are the remedies in our home flu kit, if that's of any use.
Thank you.
Definitely is of use. Definitely. This is the exact exchange we were looking for.
And we don't have chelidonium. We have our natrium acinicosum. We have pyrogen in it because we had as many cases of eupatorium than pyrogenium. Rostox, because we had quite a few cases also. And we had also carbolic acid. We didn't talk about carbolic acid, but carbolic acid is also a medicine which we used when the weakness was upset. You know, this extreme weakness, sudden weakness, and with respiratory problem. It works also in such cases. So we put it in. And did I say spongia? Because we had quite a few cases of those spongia. And I don't have them all in the head, but I think that we try to put all the medicine which we had till now, in all our cases, and made a slightly different kits than otherwise. But with 10 medicines, mostly you get quite a good base.
Quite a good base. The interesting one is Rustox.
Yeah, we got really a few. Rustox is a great flu medicine, so why not? I mean, why not? And we got them. This eupatorium, pyrogen, Rustox are very, very near. What we didn't get at all, which we get is sometimes in other viral epidemic, is Baptisia. We didn't get any case of baptisia. Until now, no cases. But,
some of my colleagues had baptisia patients here. Some of my colleagues had baptisia patients here. Baptisia we had given for COVID, yes, fever in the initial stages, and worked very well. The patients turned COVID negative after having.
I think what is interesting, I mean, we know this from the epidemic, how we treat with homeopathy, is that there is also kind of a local genius epidemicus. That's why it's very important to exchange our views, but also keeping this always in mind, that what is good in India can differ slightly from what we have in Switzerland and differ slightly from what you have in other parts of the world. But there are some common things. For example, from what I heard from the international community, Brianna has been from Hong Kong to China to Switzerland to whatever, Australia. It has been a very common medicine.
Yeah.
Yes, and this dancing around arsenicum, be it baptisia or sarcolactic acid or natrium arsenicosum or China arsenicosum, this is a bit of dance around it. And I think you got the Rus-Tox cases because of the Swiss climate.
We got I mean, you might not be wrong, because we got them in autumn.
Yeah.
We didn't get them in winter, we got them in autumn, when we had this change into the humid, cold climate, which is the time of Rus-Tox.
I think so, that it is depending on that. So it's very interesting, highly intellectual talk today. So may I ask you about your summary or things you want to say, things that haven't been said yet, so that we come to our last words, final words?
Okay. So I'm not going to say that I'm looking forward to treating COVID-19 patients. I hope that we don't have any to treat. That would be a good outcome. But in the case that we do have COVID patients with post-COVID syndrome, whether in Australia or outside Australia, I shall be very happy to try and help them. And I guess I'll be using my system that I've already explained in a different way with the COVID-19 no-surge that we have available.
Thank you.
I found this session today very interesting. I would like to thank everybody because we could really learn a lot, I think, from each other. And I hope that I find the idea of Dr. Rajeshwari is very good, that we meet again in some times, and that we get more experience, we get better and better, and then we can help the people better and better. This is our job, no? To try to always be open to gather new experience. And I hope that we find a solution to collect all these cases. This is very important.
Yes, once again, a call to send in video testimonials, which we can publish on the channel.
Yeah.
Yes, I think we are going to meet again in May. Should be a good time, so that we can overlook a longer phase of COVID, and I hope that we can join in Dr. Patel that time. Michael and Rajeshwari, what do you want to add?
Yes, it was good interacting with all of you, especially Dr. Michael Frass. For the first time, I'm in the webinar with him. My message to all the people is that don't panic now, because COVID is over almost. And this post-COVID syndrome is nothing but most of the times the psychosomatic thing, because of the panic, because of the trauma they have been gone through. If they were corona positive, then that trauma still remains, and then they are into a panic situation that it may come again, or maybe they will experience such symptoms. Because of this, they experience the post-COVID syndrome. So let them come out of that completely as a fresh person and be happy as ever, and that leave away the trauma. And one thing I forgot to mention, that arnica also I had given to many people, which also helped to come out of that fatigue after corona. So arnica is also, because it's also a traumatic medicine, not only physical trauma, but also mental trauma. So experiencing that COVID or getting hospitalized is a trauma for the patient. So arnica is also suitable for many of the people in post-COVID fatigue syndrome. So this is my message to all of you. That's all.
Thank you. Some people just feel beaten up by all the restrictions. It's absolutely right. These are arnica cases. And they tell in the words, I feel beaten up.
Or you have arnica cases in the one who are still dreaming of the I had a case like the dreaming of the hospital situation, dreaming of it, you know, like they have, like arnica has it after an accident, no, living the accident at night, no? So in such cases, yeah. Thank you to mention it, yeah.
Michael?
So, Marianne, I just want to thank you so much for putting this meeting together. I think I've learned a lot, and I just believe we have to maybe collect all our experience with respect to chronic fatigue, and maybe then we have a little bit more chance to help our patients. And I think everybody from her or his standpoint of view can give some hints and some help for these patients, because I think it's a very severe syndrome, and it may also increase also in patients without suffering from COVID, but because just of the problems of lockdown, which is a big problem in our country.
Definitely, definitely. And here too. And the next thing I'm waiting for is people being vaccinated and not being well in the phase they are vaccinated. Not being really in a healthy state. That will create another problem, which will be interesting to discuss once we see the symptoms. So thank you very much for being here. Thank you, everybody. And I hope we will meet again latest in May to discuss what the further outcome of the chronic fatigue and COVID is.
Thank you.
Thank you very, very much. Thank you for being here. Thank you, listeners. And yes, the listeners say thank you to you.
Thank you, all of you.
Thank you.
Okay. Bye.
Bye.
Yes. Bist du immer noch live?